So adrenal fatigue is one of the most pervasive yet underdiagnosed health conditions affecting people today. You said in, didn't you? Oh dear. Okay. The decrease in optimal adrenal function has become a common occurrence in modern society. It includes all ages, occupations, races, social and economic groups, and contributes to the combined process of ageing. We all know, as we're taught in medical school, the two most commonly recognised adrenal diseases are Addison's and Cushing's. Here we can see the pigmentation in an Addison's patient that responds well to corticosteroid therapy. Here we've got abdominal stereo of Cushing's, young boy with Cushing's disease with cushingoid face and buffalo hump. However, in a typical clinical practice, the concept of low adrenal function is limited to the more or less chronic Addison's disease, with all the subtle increments between normal and Addison's that constitute adrenal fatigue being ignored. Doctors see adrenal fatigue sufferers in their office every day. We all hear patients say, "I'm sick and tired of feeling tired all the time." Yet adrenal fatigue is seldom detected by most practicing healthcare professionals. It's not looked for, it's not properly diagnosed when signs and symptoms are present, and it's seldom properly treated even if recognised. So detecting subtle endocrine imbalances. Difficulties in relying primarily on endocrine lab test interpretations. Tests are defined according to statistical norms instead of physiological optimal norms, leading to a deceptively broad lab range of normal functioning, with no allowance of biochemical individuality. Hormone receptor sensitivity is usually not measurable. Blood concentrations of some hormones change so subtly that the changes cannot be detected by standard lab tests. And diurnal or cyclic hormonal variations are typically not provided as part of standard reference ranges. In this bell curve for blood cortisol levels, you can see Addison's and Cushing's at the two extremes of the curve, but 95% of scores fall within the range of the curve and are considered normal no matter what the patient's signs and symptoms are. The classic signs and symptoms are not the common ones. Subtle endocrine disorders often do not progress to the more classic signs and symptoms, but continue as vague and seemingly unrelated symptoms for years. Because of their close interrelationship, more than one endocrine organ is typically involved. Furthermore, the same symptom can result from disorders of different endocrine organs, for instance, myalgia with both low cortisol and T3. Adrenals and stress. The preeminent role of the adrenals in stress came into prominence with Hans Salyer's series of experiments between the 30s and 60s and his general adaptation to stress or gas theory. In this model, stress reactions affect mainly the adrenal cortex, not the medulla, and his model basically has three phases of response: alarm, the resistance phase, followed by the exhaustion phase. And you can see basically in this picture we've got the initial alarm phase with a cortisol spike, followed by a drop in recovery, continuing along in the resistance phase at normal cortisol levels, and then with additional stress, basically cortisol levels plunging into the exhaustion phase. So basically in the alarm phase, we've got adrenal gland activation. In the resistance phase, we've got a readjustment phase. And the exhaustion phase, sickness and or death can occur if readjustment is not complete. So in the alarm phase, the physiological changes are as follows: adrenal congestion and hypertrophy with depletion of lipid and vitamin C stores in the adrenal cortex, increased secretion of cortisol followed by a decrease in secretion, thymic atrophy and lymphoid tissue atrophy. Also in the alarm phase, we see an increased incidence of stomach ulceration, increased concentration of blood, decreased body rate, lowered resistance to stress, and almost complete disappearance of eosinophils. In the resistance phase, we get an accumulation of secreting granules in the cortex, diluted blood, returning of body weight to normal, and an increased ability to withstand stress. In the exhaustion phase, we're actually seeing cortical atrophy, with subsequent decreased cortisol levels, decreased ability to withstand stress and premature ageing. So in this graph we can see the initial cortisol spike in the alarm phase, stage 1, and a gradual decline of cortisol into stage 2 and 3. With pregnenolone and DHEA, we're seeing, particularly with DHEA, we're seeing DHEA levels plunging early from stage 1 onwards, and pregnenolone starting to plunge into stage 1 and 2, with gradual decline of all of them in stage 3. So adrenal hormone secretion in females, the adrenals produce the only appreciable sources of DHA and testosterone, and after menopause are the major sources of estrogen and progesterone. In males, they're the only source of DHA, estrogen and progesterone, and after andropause are the major sources of testosterone. Summarised in that biochemical chart. The adrenal glands are essential for life. There are energy producers. They control carbohydrate, protein and fat conversion to blood glucose. We rely on them for aldosterone, for fluid and sodium-potassium balance, involved in fat storage and sex hormone production, particularly after menopause and andropause. Running around this chart, you can see cortisol being involved in blood sugar control, mobilising blood sugar from our glycogen reserves. On the brain, it's involved in mood, excitability, electrical activity, thoughts, memory, mental clarity and focus, preparing us for fight or flight. It also impacts on, it's very important for our blood sugar regulation, and it increases contractility in the heart. That's basically a further summary of what I just said with the HPA excess. So optimal adrenal health is one of the major keys to enjoyment of life. We can't live without the adrenals, and we can't live very well when the adrenals are depleted. Adrenal fatigue is adrenal depletion. If the adrenals are totally depleted, it's called Addison's disease, and it's a medical emergency that can even result in death. However, most people who have depleted adrenals are not medical emergencies and go through life wondering what's wrong with them. These people are adrenal fatigue sufferers. Definition of adrenal fatigue: it's suboptimal functioning of the adrenal glands at rest, under stress, and in response to constant, intermittent or sporadic demands. In 1898, we've known about adrenal fatigue for quite a long time. 1898, Emily Sargent first described it in France as a sequelae to severe influenza. And during the 30s to 40s, adrenal fatigue was recognised and successfully treated by tens and thousands of physicians. Our adrenals are constantly under assault in life from numerous stresses, which detailed in that slide. A lot of our patients feel flattened and look like that horse on that chart, under stress. So onset of adrenal fatigue: after a long period of stress or one severe stressful event, such as loss of a loved one, death in the family, marital discord, surgery, trauma, burns, motor car accident. We often hear these stories of our adrenal fatigue sufferers, so that one event that tipped them over the edge. Someone who's driven themselves to exhaustion and had no time out, overwork with little play for rest and R&R, or even after extended or severe respiratory infections. We've often seen that as well. Commonly reported events: lost productivity at home and work, increased marital discord, burnout in sporting activities, missed promotions and opportunities at work, forced decreased income to lower stress levels, and decreased energy reserves to properly parent. We often hear our patients saying, "I catch everything going around," all the coughs and colds, and often increased incidence of allergy or atopy type reactions. A number of conditions are involved decreased adrenal function, namely fibromyalgia, chronic fatigue syndrome, autoimmune disease like rheumatoid arthritis and lupus, cancer survivors, AIDS survivors, asthma, COPD, and most diseases requiring corticosteroids.